right. Well, good to be back with you all. Talking about more things that significantly benefit our community, especially the
Yes.
wellness of our community. And
Wellness in Woodford.
wellness in Woodford. Exactly.
That's right.
And one of those programs is a program that we've always offered here in the health department to benefit mothers and children. The WIC program, which, we have so many acronyms. But
I'm used to that. I was in the military.
so you get it.
Yeah.
But Kelly, can you tell us about the WIC program and who is eligible? It's women, infant, and children. That's the
correct.
WIC acronym. So I think that probably sums up at least part of that question.
Yes.
But if you could tell us more about the program.
Absolutely. I am also very well versed in acronyms because I'm a registered nurse.
Yes.
For 25 years, so lots of
Yes.
acronyms
Oh,
in
for sure.
that field. And I also serve as the clinic manager here, and I love my job. I
Oh, yeah,
love
we
helping.
so just in
I
case if you haven't
know,
heard
I'm
the
sorry.
episodes in the
That's
past, I mean, yeah, we're just so used to having guy around.
Right. Yes.
I don't get
Kelly
introduced
and I
anymore.
have worked together a lot. And before even she began here, we worked together because she was working in the school system. She was the manager over all of the nurses. And so she has so much experience in nursing, in health education.
Helping
And
people.
so, yes, this was a natural transition for her. And I think she really likes what she's doing. So she definitely shines, and she makes
Kelly, why are
this
you
an
crying
even
right
better.
now? I don't think she
place
likes
to-
nuts.
I know.
Cheers.
I know.
I know.
Yes. So I can't think of anybody better
Yeah, for sure.
to talk about this wonderful program.
Well,
with.
thank you. Thank you very much. I do love my job. I love our community. So, yes, WIC is a fantastic program. So, WIC is a special supplemental nutritional program that provides federal grants to states for supplemental foods, healthcare referrals, and nutrition education. For pregnant, breastfeeding, and non-breastfeeding postpartum women, and to infants and children up to the age of 5 who are found to be at nutritional risk. So at 5, you go to school, and so that's where healthy foods come in after the WIC program ends. So this serves to safeguard the health of those served by providing nutritious foods to supplement diets, and information on healthy eating. That includes breastfeeding, promotion, and support. And referrals to healthcare and dental care. We do a lot of referrals to dentists that take, Medicaid, uninsured, insured. Same thing with, pregnant moms, and then also pediatricians. So applicants are seen here by our health professionals. So we have 2 registered nurses here on staff other than myself. And that they will determine whether the individual is at nutritional risk. So that's done in our clinic at no cost to the applicant. We would love to see anybody who would love to enter our doors.
Yeah.
Any applicant must have at least one of the medical or dietary conditions on the state's list of WIC nutrition risk criteria to be eligible. So if deemed eligible, the health professional, the nurse, will then obtain height, weight, hemoglobin value to check for anemia. The nurse will obtain a history. They assess for needs for education. We do a lot of nutrition education. And at the end of the visit, the nurse discusses all the food packages with the client, what best suits them, whether they like cheese and yogurt, if they're lactose intolerant, what kind of formula for an infant. And then the client then is seen every 6 months. So they're recertified and have a mid-certification every 6 months. So you really only come in person every 6 months. We do a nutrition education phone call the 3 months in between. So we all answer lots of questions, give more education on those visits. It's a very quick phone call. And then goals are set. If the hemoglobin's low, we're going to, educate them on iron-rich foods, and then assess each time we speak and see them.
And I feel like that originally, with WIC, we had a lot of people that would maybe start the program and then wouldn't stay on the program, and that's when we saw a change in the requirements, and especially with COVID, because I think with all of our public services, we looked at ways that we could provide telehealth services or virtual services, and still, it's a federal program. And they have requirements, and so we always want to follow those. But sometimes it's difficult to bring 1 or 3 children into another appointment. And so we want to make sure to follow the family, make sure that the kids and mom are getting the nutrition that they need, and that we don't need to make any changes. But the package that you get is really based on your needs as a family. So it's not like a SNAP benefit. It's just kind of across the board. You get X amount of dollars.
Right.
These are actual programs that have been, they meet the certain nutritional requirements of the federal WIC program. And so you're getting milks, eggs, cheese, cereal, things like that do provide great nutritional value to the person that is consuming it. And so that's one of the differences in this program versus SNAP.
More
But
specific.
Yeah.
To your needs.
And usually it's kind of bi-directional. If you're eligible for SNAP, you may be eligible for WIC. If you're eligible for WIC, you may be eligible for SNAP.
Right.
So, but they do really have 2 different program guidelines. And this conversation came up when we were seeing a reduction or potential reduction to SNAP benefits. And so we were looking at all the other programs that could supplement those families. And so we wanted to make sure to get the word out that, hey, if you're on SNAP, you may be eligible also for WIC.
Yeah, check it out.
Let's come in, get you assessed, and see what kind of foods you may have access to. And I love that it goes up to 5. I don't know if it was like that in the beginning, but I feel like that's definitely a good age. That's a crucial part of their life where they're growing and developing and they're needing those vitamins and nutrients that they should be getting from food. And so that brings me to a question. How do people apply? Should they call us?
They can call us. We'd love to talk to them. We do have a Spanish-speaking interpreter here who is actually a clinic employee, so she will be in their WIC visits, and she'll help them navigate not only WIC, but any other resources they need. But there's also an eligibility tool on the federal WIC site.
Excellent.
Okay.
Yes.
That is great information.
Yes, and I'd also love to share that foster parents and adoptive parents are also eligible for this. So it's not just biological parents. And then one other thing I want to definitely highlight is that we have a breastfeeding educator. So we have an RN on staff who has extensive training and experience in breastfeeding education. So she helps, she could help anybody, but she helps our WIC clients, our HANDS clients, and she, that's just a huge passion of hers. And so that I feel very blessed to have her on staff.
Well, you bring up a good point, because we see everyone in our clinic. And I think sometimes the health department, you may have kind of a stereotype of people that we serve. We really serve everyone. And so, foster parents, grandparents, there are so many people that you could see in here. If you have a child that does have a nutrition deficiency or eating some kind of issue with feeding, call us, because don't automatically think that, you may make too much money.
Right. Absolutely.
We're on horse farms.
Yeah.
We are everywhere.
Yes.
We are on wheels.
Yes.
We have the mobile unit. And you know what? If you have kids that maybe there are some restrictions in where they feel comfortable meeting, maybe they have a disability or
that's a
something
good
like
point.
that,
Yep.
we can come to you. We
Absolutely.
know that there are a lot of access issues, and so
Yeah.
call us. Call us, make
Absolutely.
that connection. We want to see if we can serve you. We
Yes.
want to. I mean, our that's our mission as a whole.
Definitely, definitely. And then something else, while you're here and you're getting your WIC services, we also give referrals to the HANDS program, and then you can also receive immunizations here. So there's a lot of services that you can gain while you're here just in our building. And as Cassie said, we're mobile. We have a mobile clinic, so we would love to come serve you. We'll come to your house and we'll give immunizations. Like she said, we're on horse farms. We go to businesses. So any way we can serve, we would love to.
Yeah, just by calling, just what you were saying, they may not realize everything that you all do, and just by just calling, you could find out a ton of things that you may not have realized. And it's like, oh, I can do that here and do that here. That's
Yes,
great. Yeah.
right.
And
we
you can come to me.
And
It's
right.
like,
If
all
we
right.
don't do it here, we know we pretty much
Yeah,
can
where to
tell
go.
you where to go.
Yeah,
Right.
for sure.
Yes.
Oh,
love
you
to.
make a little bit too much money? Well, there's this other program.
For sure.
That's right.
There are
Yeah.
other things. And then our car seats, we also have a car seat
We
program.
do. We do.
It's not necessarily through WIC, but if you are a WIC patient, more than likely you would be eligible for a car seat.
They train you how to put in a car seat, because sometimes that could be a little
It
daunting.
can be, and you have to be certified. That's actually quite a job. And then we actually take our car seats to the fire department.
Okay, I was gonna say,
Yes.
I've seen them out there.
Yes,
putting
they're
that
great.
in.
They're a great
I'd be so
partner.
nervous. I'd be
I
like,
was-
oh yeah, I got this.
Right.
I'm Googling like how to
Yes.
install.
I was certified 20 years ago. I mean,
Yes.
I think I was an intern, and I couldn't put in a car seat for anything.
I don't even remember. I don't. And this is, I don't know, a long time ago, obviously. I remember like in the back seat playing with toys in like the back window, like you know what I mean, like
Yeah.
Right.
back in the day.
Right.
Yeah.
in
Rolling
Eastern
around.
Kentucky. Yeah, we were, we were just driving. It's just, it's interesting. Obviously, seatbelts were still a thing. So, but, so yeah, I mean, I remember when Avery was younger, some of those car seats are wide. I mean, they're in there. And there's these
Yes.
special clips that
Right.
you can't find in the seats. So a little extra help, goes a long way.
Yes,
That's
they're
cool.
very willing to
Yes.
help.
Yeah.
They're great. Yes.
I remember we had the Woody wagon, one of those old, like,
Oh yes.
did you just roll around in that? I remember bumps on my head, like,
Nails are sticking.
yeah,
That's right.
Doritos, Pepsi's
The
going
way
everywhere.
back of it.
Yes, yes.
Oh, absolutely.
I mean, yes, that was so dangerous. But
Goodness gracious.
I don't know how we made it, but we did.
We made it.
And we're
We're
here
here.
to tell you about WIC. And we
Much
got-
better things
That's
for,
right.
much safer,
Yes.
better
So the fire
things for our
department
children.
puts those in for us.
Fantastic.
Yes.
Yeah.
And so you come here and get your. Well, then we'll take the car seat to the fire department, and they'll
Yeah.
install it for you and answer questions for you. And I also, so before we end, this session about WIC, I do want to talk about our hours because we have a lot of working families.
We do.
Here. And I want to make sure that people know that we are open extended hours. We are not open on Fridays because we extend hours throughout the week, and we're limited to 37 and a half hours
Right.
by Kentucky statute. So what we noticed is we had a lot of families that were not able to come between the hours of 8 and 4:30 because they worked. And so
Sure,
we
yeah.
have extended our hours. So I'm going to
Yes.
pass it to Kelly. She's going to tell us about our hours.
Yes, we received a lot of feedback from families before we made this decision. So Mondays we're open from 7 to 7:30, and then Tuesday, Wednesday, Thursday our hours are 7:30 to 4:30. We are closed every day from 12 to 12:30 for lunch. But we would love to hear from you. We do take walk-ins. You may have to wait just a little while, not always. But call us for an appointment, or walk in, call with any needs you have, and we'll try to do our very best to answer them.
And we refer interdepartmentally, and so you may be here for one program, but you may find out that you are eligible
Right.
for others. And so we're just so excited to have AmeriCorps in our building. We have United Way that's going to be joining us.
Yes.
And so just excited to be bringing a lot of new programs and resources to the community in 2026, and it's not over yet.
That's right.
So
More to
We're
come.
excited.
Huh?
more
right.
to come.
Lots
Fantastic.
coming our way.
Yes. So if you have questions about WIC, either call us, connect with us on social media. We'd
Shoot me
love
that link.
to help you.
I'll put it on the.
Yes.
If I can find it, we'll put
Will
it
do.
on the post for sure.
Perfect.
Yes, perfect.
All right. Thank you
Thank
for
you.
joining us.